Hi YouTube, this is Builder Barbie 1 coming to you on July the 30th, 2018. I had a mommy makeover in Dominican Republic with Dr. Ferreras on March the 21st, 2018. I still have on a garment and I still have a little bit of a pouch here that needs to be gone. Okay, round 2 should take care of that. And I need more projection here. Sometimes everything can't be done at one time, and everyone heals differently and so on and so forth, and all of that. I'm trying to record this video and I keep getting interrupted. However, that's how things go sometimes. So I did want to talk about the cost of surgery. I had surgery in Santo Domingo, Dominican Republic, and I'm going to basically talk about pricing there and what I needed to do to kind of prepare for surgery, because you may think of the price of the surgery, but then you may not think of the other things that go along with the surgery. So I'm going to kind of talk about a little bit of that. I did record the content before and I posted it. However, I was using a different type of recording device. I was using a webcam, and the audio on it was horrible. You couldn't really hear me, what have you. So I'm re-recording it because the information I feel is pertinent, and I want to, deliver quality to you. So one of the things that we talk about would be the price of surgery. Now, how do you get a price for surgery? Well, when you're going overseas, as I did, you can go on Real Self, Instagram, different medias like that, Snapchat, where different surgeons, they do talk, and you get to see them, and you get to see them with their patients or their dolls. And it is very, very nice to get to see that. And, it's very nice to get to see that. And you can then kind of request a consult. Now, the consults generally are free of charge, and what it is that you send pictures in of yourself, of the part of your body that you want to have worked on, so they can see that without clothing, without underwear, so they can give you a price. I had a mommy makeover, so that was a standard price for that, and so I had to pay that. I had to send a deposit to my surgeon, and once I arrived and I was okay to have surgery, I had to pay that before my surgeon, Dr. Ferreras, would perform the surgery. The surgery costs generally includes your lab work, your chest x-ray. Let me see. You may have to pay additional if you have to have pulmonary exam, but it generally, you would know that because you do get an itemized list before you even, get over to DR. They will email it to you or WhatsApp it to you, and this way you would know what the prices are. The other thing that is required in Dominican Republic would be an overnight nurse, and that is the person who would take care of you immediately after surgery and be one-on-one with you, because those first 24 hours are very, critical, and you generally are still in the hospital or the clinic type setting, the surgery center, and that overnight nurse would be with you from 12 to 24 hours, and the price, depending on the nurse, could be from $50 to $100. It just kind of depends, and it depends on if it's more days than that. The recovery house, you stay in a recovery house when you're in Santo Domingo, and the recovery houses, the prices vary according to the recovery house, as well as whether you're in a private room, a double room, triple room, and some have quads. And the prices with a recovery house could be anywhere from $800 up, because generally you are going to stay maybe 8 to 10 days or more. And the prices for the rooms would differ, like $10 increments or so, like that. The other thing would be vitamins and iron, supplements. Okay, the price for that could be anywhere from $200 to $500. For me, it was on the higher end because I happen to be chronically anemic. So I had to build up my iron, levels. Had to take a lot of iron, liquid iron, also vitamin C, and different things that I've talked about in other videos to kind of build up my hemo. Okay. And the other thing would be the medications that your surgeon would definitely have you use. And those medications could cost anywhere from $150 to $350, depending on the surgeon. And what that includes would be omeprazole to help your stomach to be able to tolerate the antibiotics, which is 2 that you will be taking orally. And they also run some antibiotics during surgery. Along with other supplements that you need to take while you're there. Now, if you can get your PCP or your family doctor to prescribe those medications, then your insurance would pay for it, and then it's a good thing for you that your doctor wrote that and you could have your insurance pick that up. If you happen to be chronically anemic or arrive to DR anemic, depending on your levels of anemia, you might need to have an iron infusion. How much are the iron infusions? I believe that they're somewhere around $15 or less. They're not very expensive, and it runs into your arm, or your hand, wherever they put the IV, and it runs maybe over a half hour or something like that, and it can build up the iron level rather quickly, so that you can meet the hemo level that your surgeon feels would be appropriate for that particular surgery for you, and safely to have surgery. The other thing that you have to include in your figures would be blood transfusions. Each unit is $150, and generally the surgeons will want you to reserve 2 bags, which would be $300 that you have to pay on top of your surgery fee. And if you do not need the blood, when you go for one of your post-op appointments, they will then give you back that money. Now, if a person happens to become anemic, and they need to have blood, that blood, would be 1 unit first, depending, and then you may need 2, or you could need 3. It just kind of depends on what your hemo level is. Okay, because usually the surgeons will want it to be at a minimum of 12.9, and some would like it to be higher. And so what happens is you're eating a bit healthier, you're taking the iron and vitamins and supplements and things like that in hopes that your hemo level would stay up so that you could safely have the surgery. Your surgical fee generally includes a stage 1 Faja, which is similar to the one that I have on, although it's softer, and it allows them to put, to pad you with your pads, your lipofoam, and all of these different things, and then you come out looking like, a Michelin man. And so you wear that until you have your first post-op visit, and your first post-op visit could be maybe 2 days later, and at that point your surgeon would then say whether or not you're to get into a stage 2 Faja or what have you, or how long before you can get into a stage 2. For me, what I chose to do was to get a stage 2 Faja there, which was a standard Faja. The Recovery House, they had a book, and I was able to order one, and it came, I believe, that day or the next day. It was $153. The Fajas are, if you purchase them through the Recovery House or through the surgeon, they're about $150 depending. And the stage 2 provides more compression. As you can see, I am, very much compressed. So that would be a stage 2 Faja, and depending on the type that you get, you would have to have it altered as your waist shrinks. You just only take the waist in, just only the waist. And there are places that you go for that, and that's a fee that could be, alteration fees could be $20 or $30. It depends on where you go. Once you get home, stateside, generally you would get another Faja. Now, what I chose to do when I was in DR, I not only got the standard Faja, but I was measured for custom Fajas, and those met me when I arrived home, maybe a week later, and they were to my my specifications, and so I had those, and then I also ordered two more fajas. So generally like four are pretty good, because you always want to have one on, because you should only be out of your faja maybe an hour or 3 or 4 hours out of a day, depending on your skin and your condition. And then, because you need to wash them, you need to have them to hang dry, not in a dryer, but to hang dry. And that takes time to dry. So if you have at least four, you have, changing. Okay. And the other thing would be waist cincers. Okay, waist cincers. I have here, this is one. I ordered this online. I paid $15, and I have a small and I have a medium. The small I put on the upper abdomen, the medium I put on the lower, and it compresses me even more. I'm sorry, I didn't mention the prices of the fajas. The stage 2 fajas, when you're stateside, could be anywhere from $100 to $200 a piece, and you generally, like I said, need about 4. You may be able to get away with having 2, but 4 usually is kind of like, to help you out, where you can change and dry and da-da-da-da, all of that. The waist cincher that I showed you, could be anywhere from $15 to $100, because they vary depending on where you order it from or purchase them. The prices could vary. What I also have are this here is a waist trainer. Okay, this is a waist trainer, and I do wear this sometimes. This one is a pretty one. You could kind of wear it over your clothes. Obviously not over this dress, but you think it may not fit me, but it actually does. And it compresses nicely. And so waist cincers or waist trainers, they could be anywhere from $15 to $100. Then I also have listed the corsets. Okay, these corsets, steel bone corsets, you can order them. Okay, and you can get them at prices of, it depends. You can get them as inexpensive as maybe $15 up to $150. It just kind of depends on the type that you get. I have this one, and I have another, which I probably will talk about in another video. Corsets are from $75 to maybe $150. I mentioned that. The lymphatic drainage massages that you would have overseas, the prices are between $25 and $35 a piece, and it is recommended by most surgeons to have a minimum of 10. So you see the prices are adding up here. When you return home stateside, oftentimes you can get a package of 12, and it may be from $600 to $800 depending. I would also encourage you, before you go for surgery, to find the spa that does a type of massages, and you schedule a post-op massage. Soon as when you're having surgery and you're coming home, make sure that you have a massage once you get right off the plane, because you will definitely feel better. The massages packages can cost anywhere from, a 12-pack could be anywhere from $600 to $800. So it just kind of depends, and then you get sculpting massages, and the prices can go up. Recovery boxes and supplies could be anywhere from $300 to $600. It depends on whether you want a pre-made box that are offered, and you can find those boxes on those who sell them, maybe on Instagram, maybe Facebook, different places like that. Or you can purchase your own supplies individually. It just depends what you would like to do. You do have some suppliers that meet you in DR with the box, or you can purchase them and take them with you. It just kind of depends on what you would like to do, but the cost of those could be anywhere from $300 to $600 depending on what surgery you are having and what you would need. Compression stockings are a must. Okay, the ones that my surgeon recommended come up to the thigh, and they were $30 a piece. What I did for myself was I had 4 pairs of compression stockings, the ones that he recommended the day of surgery, and then I also had 3 different ones that I could change in the recovery house. I had one that zipped on the side, and then I had 2 others that you could pull on, and those came to the knee. And I wore those even until I came home, and sometime while home. I am a little bit uncomfortable in my faja, just a little bit. Sometimes you feel them and sometimes you don't, and you know, my skin is so sensitive till I kind of feel a little bit, so I'm kind of moving it around just a little bit so I can get a little bit more comfortable. Yeah, so once you're stateside, the other things that you may want to purchase would be a BBL pillow. Those could be from $50 to $100. Boppy pillows, that could be from $20 to $50. Female urinal, I highly recommend the female urinal as opposed to the P-Easy. Before I went for surgery, I practiced wearing some standard fajas, and I tried to use the P-Easy, and guess what? It was not easy. So I found that using the female urinal worked out really, really well. And when I was in DR, this worked out well because I would have it at the bedside, and when I had to go to the restroom, you know, you can't move that fast, okay, because you're all bandaged and this and that and so on and so forth. So having this at the bedside, I could use this, and then I could go to the restroom and I could discard it and not feel, you know, pushed or not mess my faja up or what have you, you know. So I found this to be ideal for me, you know, and this was like $15. Right, $15. The other thing that you hear about is a lipo itch. Is it true? Is it false? For me, as well as many other dolls, it's true. So what do you do for the lipo itch? Well, you can have a very nice back scratcher. This is a wooden back scratcher, and depending on where you get it from, it could be $1 at the dollar store, or it could be $20 or so, depending on where you go. A wooden back scratcher, I would say, would be okay because it will not generally cause trauma to your skin. So, you know, this is something that you generally would end up using maybe about a month out. That's usually when you kind of start itching because it's the nerves that are kind of mending back together. These back scratches I do not recommend probably ever for any reason. I purchased them. I thought they were rather cute. However, you know, they're very sharp, and you know, your skin, you're sensitive to certain things and certain things not, and you might do damage to yourself with this one. So, you know, it's nice, it's telescopic and everything like that, but I really wouldn't use it, you know, post-op or really at any time because it's very sharp. Why did I purchase them? I don't know. I just purchased them, but actually I purchased them because they had some cute colors. There was a green one, a blue one, a pink one, I think a red one, and you see this black one. And so they were pretty, but not very practical. Oh, a grabber. Oh, yes. Let me just kind of move my screen up here a little bit. Okay, a grabber. This is a lifesaver. I purchased this once I was home. I ordered it online. Okay, and grabbers can go anywhere from $1 to maybe $15 or $20 depending on where you get them from. The dollar store has them for $1. And it can help pick up things. You can grab things high, grab things low. It's good. And the ones that sometimes you get from the Dollar Tree or the dollar store are shorter, and they can fit into your suitcase. And when you're away having surgery, if you need to pick something up, you can kind of pick something up and, you know, without having to bend, because it's hard and you will be uncomfortable. So this comes in handy while you're having while you're post-op in DR and when you get home. This is something that is very, very handy. And you'll thank me for that. Meal preps. Meal preps, when you get home, you're not going to feel like cooking. You're probably not going to feel like going out to eat. You may or may not have someone to drive you and take you around and different things like that for food. It is important to eat high protein food, healthy fats such as like avocados or something like that, and things that are high protein. And you need to keep your hemo level up with, spinach and different things like that. What I did, I prepared some meal preps. I bought the containers online, and I made about 2 weeks worth of meals, breakfast, lunch, and dinner. I made these cute little, I took a muffin tin and I put some eggs in there, and with a little bit of spinach, a little bit of peppers. Let's see, what else did I put in there? And I had like these kind of muffin kind of things that you could eat for breakfast, and you could just pop them in your mouth, and that was like really, really great. So, and then for lunch, I had prepared, say chicken, maybe mashed potatoes, maybe spinach, different things like that. I can eat the same thing every day. It doesn't bother me. So I kind of like had different things like that so that I would be able to eat and not, not skip any meals. Taxi driver, Uber, or Lyft while home. The fee for that could be anywhere from $100 to $300, because remember, immediately after surgery, you're not going to be able to drive, especially if you go overseas where the lipo is aggressive, so you're going to be uncomfortable. You're not going to be able to drive, so you would rather have someone take you, or you're going to have to get another means of transportation. I suggest that you really do set money aside for it, so there is no reason for you to skip out on your massages. Check the prices ahead of time, what an Uber would cost you to get back and forth to your massages until you are able to drive or someone can take you. What I suggest is to set aside like $100 to $300 for that. One other thing that I found very, very helpful for me when I was in DR was I had a folding cane. By me having a tummy tuck, you're bent over, in which that hurts your back. However, if you have a folding cane, which I had, it comes in very, very handy, because you can put pressure, you're holding on to this, and it takes the pressure off your back, and you're able to walk a little bit better and a little bit more steady. And I purchased this online, and you can get something like this between $14 to maybe $30. It just depends. This one is a folding one, and I like pink, so of course you end up spending a little bit more money because I wanted the pink one, but hey, I like the pink one. Protective hairstyles. Yes, once you have your surgery, you're probably not going to feel like doing your hair. So ahead of time, you think about the season that you'll be having surgery, the time that you're going to be recovering, your hair, what you would like to do with it. Now, a protective hairstyle, that could be anywhere from $50 to $300. Maybe you have braids, maybe you have a wig, maybe you have a weave, maybe you just whatever it is. You have to think about that too, because once you've had surgery, you're kind of not going to feel like doing your hair or whatever, but you might want to be on Instagram and or YouTube making videos post-op, and you still want to be looking camera ready. Okay, so you can have a protective hairstyle, like I said, between $50 to $300, depending. A hyperbaric chamber, that is it's a chamber that is prescribed by the doctor, and you're in this thing, and if you're claustrophobic, it's just not going to work for you. But you're almost in this thing where there's not much room, only you, and you're covered up, and it infuses oxygen, which promotes healing and a sense of well-being. Some dolls have a treatment before, and some have a few afterwards, especially if they've had a lot of skin removed due to weight loss, and for different reasons. They may have the hyperbaric chamber treatment. And the prices for that could be anywhere from $50 to $100 each session. From what I understand, 4 sessions, usually people will get maybe, 2 to 4, if they get any at all. The other thing would be surgery related clothing. That's $50 to maybe $200. You would not wear a dress like this, okay? You would wear something, a flowy maxi that has pockets, because remember, you're going to have a drain. You need that drain to fit in there. You may want to have your cell phone, whatever like that. So you want to have something flowy, something comfortable, because if you go to DR, no matter what time of year you go, it's going to be warm, because why? It's a tropical place, okay? So you want to be comfortable with the appropriate attire. Remember, you're going to have on a faja. The straps are like this large. If you have surgery on your arms, lipo or something, you're going to have sleeves. So you got to think about what you're going to have on. So you need to plan what you would like to wear comfortably. So the maxi dresses are a very good idea. I would suggest maybe having no more than 3, because in the recovery house you're going to really wear your faja. You may have on a robe or something like that you can get at a very inexpensive price. But maybe 2 or 3, maybe 3 maxi dresses. One maybe for going to your doctor's appointments, and then if you're feeling like it, you might want to go out and have something to eat once you're closer to time going home, or go sit by the beach, and you'd want to have something to wear. So again, that would cost maybe between $50 to $200. The pain pump. I chose to get the pain pump for a few reasons. One, I thought it would be very good so that my body would focus on healing rather than pain. The cost for that could be anywhere between $200 to $300 for 2 days, 3 days, or what have you. And did it get rid of all the pain? Absolutely not. Did it help? Yes, it did. Because I heard that when you have a BBL, you feel like they put hot rocks under your skin. Well, I did not want to feel that, so I got the pain pump. And no, I am not a punk to pain at all. I had a full mommy makeover. I had my liner tattooed, my lip liner tattooed. I've given birth to twins naturally without any medication or anything. So I'm not a punk to pain, but I had an option, so I chose to take that option of the pain pump. And I was up and walking, and I set my phone to alarm like every 2 to 4 hours, even at night, so that I would get up and I would walk back and forth with my trusty cane. And I was on the 2nd floor, so I was able to kind of lean over the banister, which kind of took some pressure off of my back as well. And then I would go back to bed. A safe. You would need to have a safe. And where did I put the safe? 1 second. Okay, here is a safe that I purchased. Okay, and I got it. Why? Because it's pink. And this you can hold your money in and your passport in, and you never let this leave you. You can leave it only in the safe at your recovery house, and or you would give it to when you're having surgery, to the doctor's assistant, or you leave it in your safe at your recovery house. It depends, but you are recommended to get a safe. This could cost anywhere between $10 to $20 depending on where you get it from. I ordered mine online. You can tell I order a lot online. Fanny pack. You know what a fanny pack is. Generally, you're going to want to have a fanny pack or a small bag that you would be able to keep some of your money in, your ID, and your passport, because you always have to have that with you. And you want to have something, you may want a fanny pack. Like I had a fanny pack, but I didn't put it around my waist. I carried it across my arm. And I didn't go anywhere other than really to the recovery house. Later taught as I was healing. I did have a manicure and a pedicure elsewhere, and I was able to do that. But I did have the fanny pack more so as a purse kind of, and I was very careful with it. And then I did eventually put it around my waist, so I did do that. And fanny pack could be $10 to $20. You can find them pretty much anywhere. A carry-on suitcase between $20 to $100. To be honest, you only need a carry-on, some kind of rolling suitcase with the telescopic handle, and maybe a backpack. The rolling suitcase, that's where you would put your supplies, your dresses, your different things. Don't overpack. Just make sure you take enough money that just in case you can purchase other things, and find out what your recovery house has, because sometimes your recovery house has a lot of the supplies and you would not have to purchase them because they have them. I know I purchased a pre-made box and I left a lot of things behind because I didn't want to bring them back. There were things that were unused. So a doll lucked up with getting to use some of the items that I left behind. Passport. If you're going overseas, you know that you need to have a passport. If you're renewing your passport or you're getting a new passport, the fees would be anywhere from $150 to $250. Also, there's something called TSA. Oh my goodness, what is the name of it called? TSA pre-screening. That's $75, and it's a check that they do on you, a little bit of a check where it's ahead of time. You pay for it, and you don't have to take your shoes off, your belt off, your this and that when you're in the airport. So it saves you that inconvenience. There's also called Global Access, which is $150. It also includes the TSA pre-check, but it goes a little bit further because you're fingerprinted, and they once they do that and quote unquote the background check, they would then know that you don't have anything in your background where you're a threat, and you'd be able to go through the airport without having to stop through so many security stops. And when you're coming home, since you're going to have wheelchair assistance, you're probably not going to have to be stopped, but it's helpful if you have it. I was supposed to get it, but I kept postponing the appointment, and then I ended up not having getting the Global Access, but it worked out fine for me because I did have the wheelchair assistance. Your flight, one thing you have to really remember about your flight is this: when you are checking prices, check the prices anonymously, like 2 a.m. on a Tuesday, because like that time of the morning on a Tuesday, for whatever reason, that's when they do price changes and you get a good price at a very low fee. Okay, if you price check anonymously, you get a better quote. You can use Google Flights. You can also use justfly.com, and there are probably some others where you can plug it in and you get a good price. I also suggest that you get the insurance because that can be beneficial to you. It's not that much to have. What is it, $25 I think, but it's good to have it and not need it. Okay, so you would also want to consider your flights. Now for me, I had a non-stop. It was 2.5, 3 hours, which was fine. Now for some people who have to have layovers with their flights going down, you maybe don't need a long layover in between because you'll be able to move around comfortably. But when you're coming home, since you're going to be post-op, if you have a layover, you probably want to have a layover at least an hour so you're able to get to where you need to go for the next flight, and that you're not rushing or hurried. I would say a 2-hour, window of time, but that depends on what you would feel. But just do give yourself enough time between layovers that you would then be able to get to where you need to be, on time. The other thing would be, Oh, your post-op wardrobe. So once you have surgery, depending on what you have done, of course, your old clothes may not fit, so you're going to need to purchase new ones. Or you will be able to get back into the old clothes that you maybe grew out of, so to speak. But either way, you're probably going to have fun shopping for a wardrobe. And that is definitely, price, specific to what you want, where you shop, and what have you. But that's something to keep in mind. Some fun things would be microblading. I had my brows microbladed. That fee could be from $80 to $300. The lip liner, eyeliner, that could be from $80 to maybe $120. Sometimes you can get them done in the recovery house, or you may need to go to a salon to have it done. It just depends on the recovery house. Sometimes, the technician will come to you, or you, like I said, or you go to them. Shopping and dining, that's price specific. That's specific to you. Could be from $35 to maybe $200. It just depends, because maybe you want to go out and eat, or maybe you want to have something ordered in, or you want to go shopping, or what have you, get souvenirs. So you would want to have something set aside, maybe $35 to $200 for that. A personal driver. Now, your recovery house will supply you with a driver to get you to and from the airport, to and from your doctor's appointments, and to surgery and back. That's generally the only thing that the driver from the recovery house would do. Now, if you want to have other things, go other places, you may need to get a personal driver. And they have them. They're listed on Instagram, on Facebook, what have you. And what you do is you follow them, and then you see dolls who go to them, and you find out who's this, what this, that, or the other. And, that could cost you anywhere from $35 to $200. It just kind of depends. If you don't find one ahead of time, once you do arrive in Dominican Republic, usually the recovery house managers, they can tell you someone just in case you want, or maybe your driver at your recovery house might do it as well. The other thing that that is recommended is extra money. You never know what might happen. You may have to stay extra day in the hospital because you needed a blood transfusion, which then would mean extra days at the recovery house. Anything could kind of happen. You may run out of supplies. You need this, you need that. This money here is set aside that you would think that you're not going to have to touch, but just in case, if you do need it, you have it. So I would suggest that you take at least between $1,000 and $2,000 extra. That is really, really, truly extra, where you don't have to worry about, oh my gosh, what if this happens, what if that. At least have that. And so you can see, planning your surgery journey, there's a price tag to that. You are worth it. You do plan for it, save for it. There are different ways that you can save. Every time you break a $20 bill, the change, you save that, or you fill up a jar with pennies or quarters or whatever, and you can save that. There are different ways. Some people, they work extra jobs just for surgery, or overtime just for surgery, or some people have a sugar daddy or something like that, or a sugar mommy, all kinds of different ways that you can pay for your surgery. You can just save. A lot of people save their income tax, and then they go to save and prepare for surgery. It probably really takes about a year, because you do want to research your doctors. You do want to research the procedures that you have. You do want to follow some dolls that have gone to your surgeon. You want to follow the recovery houses, get different feedback from the recovery houses, from dolls that talk and video the recovery houses. Those are things that you want to find out about. For myself, what I did is I'm very active on Instagram. I've posted different things on YouTube about my surgery journey. I've posted different things on my Instagram page about my surgery journey. So you kind of have an idea of, what's going on, what to expect. Oh, something that I forgot is this. This You can put lotion on it, and you can reach your back or your legs or whatever. Because sometimes if you're home alone and you need to put the lotion on or something, you know, you want to be able to get to it. So this is something I ordered. This was only a couple of dollars. Who knows? Maybe $5, $10. You can probably find these almost anywhere. Working on your scars. You know, surgery, you're always going to have some type of scar. And depending on your skin and the way the incisions are made and how you heal, would determine on what type of scar you have. Now, this is just cocoa butter. You know, I find that using this has been helpful for me. My incisions healed over pretty nicely. The only issue that I had was at one point, I had an allergic reaction 2 days, excuse me, to the tape before leaving DR, and so I broke out and da. So I then had to wear, when I got home and everything healed over, I purchased this, and this is silicone tape. You know, silicone tape, and this is good for scars. This one I ordered, and it's perforated, so you actually don't need scissors. It has perforation, and you know, you can use it, and if you use it well, you can reuse it. I find that it softens the scar, made it a little bit lighter. I'm not too concerned about the scars, but I do want to have the best looking scar that I can have. You know, I was thinking I would get a tattoo here because I do enjoy tattoos, as you can maybe see. But I have to wait until I'm healed up. The other thing is this massager. This was something that I used a couple of times post-op. You can order this online, or you can go into a store and purchase it. And these go from maybe anywhere from $20 to, you know, $50. It just kind of depends on, you know, where you go and look. You may want to have a journal to kind of journal about your journey, and you know, that could be whatever price, you know, you choose to pay. It could be something like this, or it could be a composition notebook or a diary or what have you, just to kind of chronologize your journey, because you'll find that when you do videos or you take pictures or things like that, you see the changes in you, and it can be very exhilarating to see, you know, where you came from and where you are. I think that's all I needed to share today in this video. I will, of course, be making other videos. I know this video was long. However, I hope that the content is helpful. And I should have told you at the beginning to get some popcorn or something, huh? Sorry I didn't tell you. But thank you so much. Please do subscribe to my channel. Comment, like. Down below you can leave questions, and I do my very best to answer your questions. If I don't have the answers, I can try to help you do some research to acquire the answers. Again, I'm sharing my journey with you in hopes that it's helpful. You are now part of my journey, and I am part of your journey. And what I would like to say is thank you for allowing me to be part of your journey. All the best to you in your journey. Do take care. Blessings to all. Oh, let's get one more little picture. Ferreris doll. Gotta get rid of that. But that's nice. Woo! Yep, that's me. Thank you once again for sharing my journey. Thank you. Blessings to all.